Hi.
Hi.
How are you?
I'm good, and you?
Hi,
I'm good, thank you.
you're in the build. Hi, can you see me?
Hi, Catelijne. We've got time. Sorry, I was just jumped over from the other one. This isn't live yet or anything,
Okay.
so that's fine. Let's
Good.
just try to get. I'm just gonna see who else is on. Is it just us two so far? Yes, it looks
so.
like.
Vidya, Vidya, can I ask you something?
Mm-hmm.
When I'm sharing my screen, do people still
Mm-hmm.
see me?
Yes.
Oh, they do.
They see all of you.
As well as my screen share?
Yes. So they can see, we can see everybody when you do your screen share. But on the backstage, everybody looks equal. But when you do the screen share can, they can double click it and it's bigger, basically.
Yeah.
So
okay.
you mean the slides? Yeah, they'll be able to see it.
They'll be able to see me. So no, that's important so that I can start reading from a from a document. I would have to.
They can see you. Yeah.
They can see me. So okay.
Yes.
That means that I have my. Oh. Yeah, that I have my presentation here also on the side to see.
So we've got about 10 minutes before this link will go live, but it will get announced that it will start at 20 past.
Okay.
But let me just, your audio's fine, Nathalie, your audio's fine. Let me try and get Bart, Virginia, and Frank on.
Yeah.
So I'm gonna go, because I want to ring them, basically.
Okay.
And I'll leave you guys here for a second.
Thanks.
Alles goed?
Ja, met jou?
Ça va, ça va.
Ja, ça va. We hebben een soort van tweede lockdown, hè? Heb je gehoord?
Ja, echt?
Ja, en ze noemen het een lockdown light.
Ah ja.
Sinds gisteravond.
En wat verandert er dan?
Horeca gaat dicht weer.
Oh, helemaal dicht?
Helemaal dicht.
Oh, wauw.
Wat was er nou nog meer? Oh ja, geen publiek meer bij sport, geen competitie meer. Amateur en professioneel. Professionele competitie is de enige die doorgaat, maar amateurcompetitie niet meer. We mogen nog maar met 4 mensen. We mogen maar 1 keer per dag mensen ontvangen thuis, maximaal 3.
En mag je nog naar het werk?
Nee, er wordt al heel lang gezegd niet naar het werk gaan. Tenzij het echt natuurlijk moet. En mondkapjes. Eindelijk de mondkapjesdiscussie.
Eindelijk.
Ja. Och, wat een eindeloze discussie was dat. Hey, als ik zo ga zitten voorlezen, dat zie je, hè? Dat werkt niet.
Als je zo zit, ja.
Ja, maar dan, als ik het zo doe, merk jij dan dat ik iets lees?
Nee.
Nee? Oké, super, want dan hou ik gewoon mijn blaadjes bij me. Is er een speciale technologie, Nathalie, aan de hand waarvan jij iets zou willen zeggen? Waarvan ik...
Die laatste vraag bedoel je?
Nee, ook de directe vraag aan jou. Waar zou jij juridisch nou op letten? Wil je dat ik dat toespits op een bepaalde technologie of meer algemeen?
Ik heb het voorbereid een beetje meer algemeen.
Oké, prima.
Vooral om te benadrukken dat er al heel veel recht bestaat dat vandaag van toepassing is. Ik denk dat dat het belangrijkste is. Hallo Bart.
Hallo Bart.
Hallo. Zo. Hoor je mij goed?
Ja.
Ja.
Prima.
Maar, hoe gaat het met jullie?
Goed. Met jou?
Je waren nog even aan het voorbespreken, hoorde ik net.
Ja, even snel. Ja. Ik doe eerst een introductie, hè, een minuut of 3. En dan begin ik met Virginia, dan Nathalie, dan Bart, dan Frank. En dan eventueel tussendoor een vraag.
Catelijne, can you just share your slides so I know it's going to work properly, please?
Let me check. Oh, I didn't open them. I have to open them. Wait.
Yeah, if you keep them in the background.
Yeah.
Hi, Bart.
Hello, video.
Your lighting's a bit. Is there any way you can?
I'll move. Yeah, I'll move.
Okay.
You look like you descended from. You have a halo behind you.
The kids will go outside and I'll move to another place.
So
this is but they have no sound, but they haven't entered yet.
And then I have to switch. Am I still sharing?
No, you're not sharing.
So do you want me to share to try that?
Yeah, so that screen share button.
Just a second.
It's fine. I'll just see what's up with their sound.
So let me just escape this. I have to start with this one. I will stop sharing and try it again. That's it. Does it work?
Yeah.
Yep.
1, 2, 3, 4. That's it. And it always goes back to this, and then I can stop sharing, right? Okay, let me put it at the first one then again. And I will close my emails. And this I can keep. So that's it. Yes.
Okay.
Hi, Virginia.
Perfect.
We were trying to connect from 2 different ones. Yeah. But now it's connected. Okay, Frank is coming.
Okay.
Okay, perfect.
Perfect.
I'm going to keep you all on rather than getting you off and telling you to come, just in case. I just think it's safer this way.
Yeah, we play like this.
And when will we know exactly when we are live?
You won't go live. You'll go live in 5 minutes on the link, but the actual session will start at 20 past.
Okay.
But we'll get the chairperson, Joel, will come on.
All right.
So we'll just let him chat for a little bit and intro the session, and he'll hand it over. Then I'll terminate his screen, and then you can go straight into your slides, etc.
Okay.
Can you all see Bart, because he's disappeared for me?
No, he disappeared.
Yeah.
Just for a second, I'm just moving through the house, finding a better
Oh,
place.
okay, fine.
No issue.
Virginia
No
and
problem.
Frank, could you move a bit to Virginia's? Yeah.
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 Camera.
This looks lovely. The two of you.
With all the kitchen in the back, but anyway.
The Dignum family is here.
Yes.
Is there anything we can do with your lighting, Virginia and Frank, just because you're a bit darker than everybody else?
I don't know what it's dark here in Sweden. What can I do?
Already? Oh, wow.
This one on.
Oh, Bart, that looks lovely with that background.
Is the light?
You think so? We fled Amsterdam to a bit more rural area,
Okay.
close to Belgium, where they do have restaurants.
Okay. Well, so you can go to Belgium for the restaurants. So you are finding
Exactly.
you are the eigenwijs trying to find the corners of the rules according to.
Who said
to
that?
Rutte.
To Rutte yesterday, yeah.
Yeah, Rutte said that. Don't go and find the corners of the law.
Yeah.
No.
I'm going to go off now, and I'll get the chairperson on, and I'll drop a message so everybody knows that you guys will be going live soon. Okay? Good luck.
Kom weg. Ja. Ja, 100%. 100%.
No, I don't know. We cannot make ourselves lighter.
Okay.
I can't see
No.
Catelijne anymore. Is that right?
Am I gone? No.
Nathalie, kun je Catelijne
Catelijne is
zien?
here. Only video is gone.
No, video's gone. That's right. And Virginia, we only see her chin. Yeah.
We're trying to get it see something with the light, but better than this we cannot make.
You should buy a ring light. You see in my glasses, I have a ring light.
Oh, I see. Yeah. Yeah. We try to put some light on our.
Mag ik hem kussen?
No.
Nathalie, we can't hear you.
Okay.
ben je weer.
Ja.
Aloha, everybody. Can you hear me okay? Testing.
Hi, Joe.
Hi,
Yes.
we can hear you.
Virginia, great to see you. And thank you all for
Nice
joining.
to see you, yes.
Thank you, thank you.
So nowadays, the only way to see people is in some Zoom square.
Absolutely. Oh, well, again, Catelijne, great to see you again, Bart, and Nathalie as well. Greetings from Geneva. Apologies, we had different emails flying around, so sorry to join a bit later, but really looking forward to your learning from your panel.
No problem.
Be great as well. So I think we'll be starting up here in a few minutes. How are you all doing? How are things where you are before we kick off?
Just one technical question because I forgot, Joel.
Who goes first?
Do we have to mute ourselves, or are you muting us when we don't speak?
I think you'll mute yourself. Actually, I'm seeing video say no muting because I think
no
we've seen
muting.
that. We've seen that hang up, but I think if we can all kind of sit quietly, and of course, no leaving the stage, just kind of standing by.
Okay, great.
Yeah.
Thank you.
So
Is it me or is Catelijne left?
No, I can still see her.
I can see
You can see her.
yeah.
That's weird.
Only
I can't.
Lydia left, but Catelijne is here.
Yeah.
Oh, okay. So
interesting.
Bart, just to confirm, you cannot see Catelijne?
No, it says the stream was unable to connect to
What you
to
may
enable
want to do,
her.
and this is always okay. So video is saying I can see all of you. So Bart,
You have to refresh.
yeah,
Bart.
yeah, you'll
that's fine.
refresh, Bart.
I'll push.
Oh, no, Bart is gone.
Bart is gone.
Bart is gone.
He would have refreshed and then he'll re-enter, and that is kind of the thing we're learning with this hop in panel.
Yeah.
Hop in and out. Hop in, hop off.
Exactly. Oh no, this is it's the nature of technology. Bart, you're back. Can you hear us?
All good. Yeah.
Can you see everybody?
I was going to say, how many fingers am I holding up? We'll test
10.
We'll test the artificial intelligence of all of this. So as I understand it, what we'll do here, and video is so nice to put this in here. What we did on the last one is we can chat for a couple of minutes, then we'll kind of go quiet as they start letting other colleagues in because there's no backstage. In fact, I think we've got other colleagues that are joining. So if you can all stand by, so sit quietly, and then we'll start in about 3 minutes.
Good.
Thank you so much. Great to see you all.
Thank you.
Thank you. This is the enjoy.
Actually, this is good to have for some virtual conference that people organizing this.
No, I really need this. I need this with session chair, session coordinator.
Session coordinator, yeah.
So we need to have some volunteers in there.
And thank you for those that are dialing in from all over the world. We'll be starting here in about a minute, and our colleagues on the panel have joined us from all over the world. So we're standing by. And again, as Vidya is saying, please, if you have any questions, put your questions in the chat, and we'll be addressing those. It's going to be a great discussion with some of the world thought leaders in this important space. So standing by for another minute, and aloha. Okay, well, thank you so much, everybody, for joining. And again, we were catching up before kicking off here with just truly some great friends and some amazing visionaries in this important subject. The idea of, again, on the last panel where we were talking about space and AI and the future, but the idea where ethics come in. And of course, we really, and I'll always say, I'm always learning from the best. And again, in meeting with Dr. Dignum, Virginia, in previous years, I know we'll be in Amsterdam in the coming years, but now we get to connect to even more people virtually. And thank you to Vidya, Sarah, and the Inspired Minds team. Welcome back. And our next panel discussion is very timely. This idea of responsible AI in the age of the coronavirus, which is, again, a global pandemic, but will not be our first. It's one of the biggest ones in the last 100 years. Greetings here from Geneva. And again, I'm with the Pacific Disaster Center. I'm an old WHO advisor, worked on Ebola, H1N1. And we didn't really have some of the AI tools back then. And what's exciting now, how can AI help us during this crisis? And this idea of, how do AI applications, the idea of privacy and other issues, how can it help us understand how the virus spreads, whether it's from satellites or mobile apps? And as we search for a vaccine, we know Dr. Bruce Aylward and so many colleagues are working with this idea of the COVAX partnership to make sure, how do we vaccinate 8 billion people in the most ethical way that we can? So again, I'm waited with bated breath and so excited to, again, introduce our panel. Again, Dr. Virginia Dignum, she's the co-founder and the board member of ALLAI. I'm a great fan of hers. And of course, she is also the professor of ethical and social artificial intelligence at Umea University. And I'm very delighted I get to meet her better half. Again, this is great to meet Frank. And of course, Dr. Frank Dignum, who is the Wallenberg Chair of AI at Umea University. And again, we're really so excited to see you both. Again, Nathalie Smuha is joining us, which is really exciting. She's a researcher at KU Leuven Faculty of Law. So really, I love the idea of bringing in the legal aspects, which we had, of course, in our last panel. The idea of, what is the nature of our legal understanding of these new technologies. So a very exciting time. Nathalie, thank you for joining. Again, Bart Geerts has joined us too, and we were testing the technology earlier, which we love. We all live and die by technology, and he's coming in from really that big picture view as a CEO, coming in from Healthplus AI. And again, Bart, it's really great to meet you as well. And again, with no further ado, we could have no better moderator, Catelijne Muller. She's the president of ALLAI, and of course, what a great effort that is with some of the best minds in the business. And I'm always monitoring that on Twitter. I was just doing that earlier. So I want you all in the audience to tweet as well, to capture your feedback, but of course, use our Q&A portion. With no further ado, to moderate the conversation, Catelijne, the floor is yours, and over to our panel.
Thank you very much, Joel. Good afternoon, everybody. My name is Catelijne Muller. I'm the president of ALLAI, and we're going to do two things today. We're going to officially launch our latest project, Responsible AI in Corona, and then we're going to go into our panel with the panelists that were just introduced to you. I'm going to share my screen with you to tell you a bit about our latest project for which we are all here. So why Responsible AI and Corona is all that it says. It is a project to promote that AI is used responsibly in the Corona crisis. But why this project? First of all, I want to stress that AI can play an important role in this crisis. It can contribute to the understanding of the spread of the virus, to the search for a vaccine and to treatment of COVID-19. They can also guide policy measures and gain insight in the long-term impact of those measures. But on the other hand, though, we know that AI can be very invasive and can have adverse effects. We see now in this crisis a proliferation of more of these invasive AI technologies than before. We see remote temperature scanning. We see wearables that measure our blood oxygen. We see facial recognition that detects the use of face masks or social distancing. We also see applications that remotely control workers, now that many of us work from home, or grading algorithms like the one the UK government used and that graded students out of an Oxford education. In times of crisis, we tend to turn more quickly to these kinds of invasive technology, and we tend to turn a blind eye when it comes to fundamental rights and ethical values and even effectiveness. We tend to think that desperate times need desperate measures. And we tend to believe that invasive technology that is indeed harmful will be dismantled after the crisis. But unfortunately, past crises have shown that this is not the case. Many technologies just stay after those crises. And that is why at ALLAI, we feel that this crisis needs responsible AI, despite the urgency, or I would rather say because of the urgency, now more than ever. To make sure and to ensure that AI actually helps in tackling the corona crisis without causing harm to society along the way. So what does the project involve? It involves several elements. We will set up an observatory where we will map the different AI applications that are being used in this crisis. We will organize expert sessions for policymakers, doctors, and the media to raise awareness and knowledge about the need for responsible AI during a crisis. We will perform research into what responsible AI in times of crisis actually involves, what trade-offs we face, how we bring principles to practice. We will conduct expert interviews that we will show on the website. And last but not least, we will perform a limited number of quick scans where we subject AI applications to a first rapid assessment of whether they align with the elements of responsible AI. So what are these elements? We at ALLAI, we have been working on advocating responsible AI for quite some time now, and we already know broadly what the elements are that are important for AI in general. AI should be technically robust. It should be effective. It should really solve the problem that it's set out to solve. It should be ethically aligned, so we should look whether it complies with our human values and societal values, such as dignity and transparency and explainability. It should be lawful, it should be in line with the law, comply to the law, including human rights, and it should be socially responsible. So we should look at what the effect of the system is on our broader society, on our behavior, on our environment. Excuse me. So I will stop sharing my screen now, because most importantly for this project, we have involved around 11 experts from various fields to help us and dive deeper into these elements of responsible AI. And I'm very happy and very honored to welcome four of these experts to this panel today. They've all been introduced to you, and I want to try with you experts to dive already a little deeper in the elements that we just discussed and see whether we can already make the beginning of a guidance for responsible AI during this corona crisis. I would like to start with Virginia Dignum, my co-founder at ALLAI and the research lead of this project. Virginia, please, could you start with your statement?
Thank you very much, Catelijne. Thank you for your presentation as well. I'm very excited to be here and also to be able to do this project together with you, all of you, and looking forward to input from the audience today, but also from the rest of the project. Indeed, responsible AI is the only type of AI that we really need at this moment to deal with the corona crisis and other types of crises which might come in the future. We need to ensure that the systems that we use are robust and are controllable. So we need to understand the governance of these systems and really ensure that we have governance principles in place that take into account the ways that the systems might be used, which are not always the ways that you design the system for. So we really need to have a constant and dynamic approach to analyzing what the systems are doing, how they are being used, and how that use is impacting people in society, how it is impact all of us in the different ways that we are working nowadays, that we are living nowadays, and how that interference of systems in our lives can really be a beneficial contribution instead of ways to control or to monitor what we are doing. So we really need to look at the governance of the systems. We really need to look at the technical robustness and technical processes which design the systems, and we need to consider the impact on people's lives and on society, the change that we are seeing in society.
Thank you, Virginia. I would like to ask you one question.
Sure.
You were one of the first to call for responsible AI in times of pandemic. When you wrote your op-ed already in March of this year, you can find the op-ed on the website if people are interested. What triggered you to write that op-ed already in March?
I think it was mostly the fact that we were seeing at that time a lot of people rushing to promote AI in all kinds of ways without really taking into account the responsible development and use that we have been advocated for quite some time with ALLAI, but also outside ALLAI. If we are going to use AI in this situation, we really need to be sure that what we are using is doing what it claims to do. We really need to have the means and the possibilities to analyze and to inspect and to get to ensure that there is accountability for the results of the systems. We don't want AI to create an even bigger problem than what we have now, because it has been designed in a rush, not taking into account proper data governance and not using suitable data sets to come up with the solutions or the restrictions or the options that it's given. So that was at that time really the idea that if we are, yes, AI can do a lot to support us in this crisis, but let's start right away from a responsible way and not go and see where we land and then try to solve the problems after we have caused them.
So let's not rush to it and use it as a Hail Mary.
No, it's easy to, often you hear that you first do and then you can ask for forgiveness, but I don't think we are in a situation in which we can first do it wrong and then ask for forgiveness. We really have to do it first, to ask for participation first and really understand what we really need to do.
Thank you. I would now like to go over to Nathalie, and I would like to say that Nathalie was also our, I might say, legendary coordinator of the high-level expert group on artificial intelligence, of which Virginia and I were both a member at the European Commission. Nathalie, thank you for joining us. Could you please give us your statement?
Sure, yeah. So I'm, as Joel already said, I'm a researcher at KU Leuven. And I focus on the ethical and legal questions arising from AI more generally. And my research looks specifically at the impact of AI on fundamental rights and democracy. And I think that we've all seen that in times of crisis, this is something that is very important to tackle. My sense is that, as Virginia already mentioned, in times of crisis, people are indeed in a hurry to try to use tech applications, including AI applications, to try to solve the crisis and to use it for good. And in a way, that's a very good thing. I mean, everyone is going to try to use the best means that they can find in order to do good. But people tend to forget that even if they have the intention to do good, you can still also cause harm. So it's not because your intention is, I want to do a good thing with my AI application, that you cannot do any harm if you don't take into account a responsible approach for it. And that's why you have ethical and legal safeguards in place that you need to follow, especially when you're in an urgent situation, because it can take just a few days to build an AI system in order to try to do good. But if you don't do it responsibly, the negative effects of that AI system can last for years and years. So when we talk about beneficial AI, we need to think about the long-term effects as well. And I also think it's very important to think about AI for good, but who is the beneficiary of that good? You cannot just do good to everyone without thinking about how it will really impact not just a certain group of individuals, but society as a whole. So we need to ask these questions from the very start. Otherwise, we will lose a lot of time.
Thank you. I have a question for you as well, Nathalie. You and I both have a legal background, and we both know that sometimes, despite popular belief, that AI does not operate in a lawless world. That there is regulation out there and that it just applies to this technology as well. What legal elements would you consider of particular importance for AI that is used in this corona crisis?
Yeah, thank you for that reminder, Catelijne, because I think everyone is aware of the fact that at the European Commission level, the Council of Europe, many other entities are actually developing new regulation around AI. And that, of course, doesn't mean that there is already regulation that applies today. And that AI systems, however they're used, need to already comply with that legislation today. And everyone probably knows the existence of the GDPR in order to safeguard data protection. But of course, there is much other regulation that applies too, especially if you look at the corona applications. You have the medical device regulation that already applies. You have safety, liability legislation. And then more broadly, you have already the Charter of Fundamental Rights at the EU level, and national constitutions also protect, of course, fundamental rights. And all of these rights apply. Concretely, I would say, if we look at AI applications to solve the pandemic, the right to privacy, the right to non-discrimination, the right to human dignity, and the right to autonomy seem to me the most important ones to focus on. And these are, and I cannot stress this enough, legal obligations that need to comply with already today. There is no need to wait for a new AI regulation to come for that. And it's also very important to see these obligations not as an either-or story. It's not because these legal obligations exist that you cannot be innovative with AI applications to try to solve the crisis. It's rather that these obligations give you a framework in order to do so in a responsible manner. So you cannot just juxtapose them against each other. You're rather spurred to think harder and consider more options. Just an example would be the corona application. At the beginning, people, used a more centralized approach to safeguard the data. But that, of course, is more privacy invasive than, for instance, a decentralized approach. So you don't necessarily need to choose between privacy and health. You can have both, but you need to consider that from the start. So I think that's an important message.
Thank you. I couldn't agree more with all that you just said. And we see a lot of these false contradictions in the discussion. Well, what do you want? Do you want privacy, or do you want people staying healthy? And that is basically not the case. You have to balance these two and maybe do some trade-offs now and then, but that is what you need to consider. Thank you very much, Nathalie. Hi, Bart. Hi. Over to you. I just would like to give an extra introduction to what Joel just said. Your company builds AI systems in healthcare. You, in particular, build an AI system that can predict if there will be complications after surgery. You're working on that right now. So could you please give your statement?
I'll give my statement. I think really looking back at this, talking more as a doctor maybe even, but I see that there's a lot of going back and forth and complexity to this matter. One, I think, that has been brought forward in this whole discussion is that we need to work together more to even allow us to build AI systems. This is from me being a healthcare provider and working in ICU. I think that's one major point, that looking at things that are possible, but we also should look at how do we actually create the fundamentals to actually do that. That might even be that we compel some vendors of systems that hold our medical data to actually be able to allow us as end users, or even more so as patients, to actually take that data out and use it for others or ourselves. I think that's the biggest challenge that we've seen. So the data ownership question here, I think, is one of the major hurdles here in this crisis, and also a fundamental ethical question, I think, that we should debate as well.
Thank you very much. I also have a question for you, very practical one, because you build these kinds of systems in a medical environment. If you were to assess an AI tool that, for example, predicts the likelihood of someone with COVID-19 ending up at the ICU, what technical elements would you particularly look at from your experience? We lost your video, Bart.
No, we have it.
Oh, sorry, I just lost it. Keep on talking.
Okay. No, I think that's a very fair question. I think we actually have a really recent example of that. So Muller van der Schaar, a professor at Cambridge, really early on with use of biobank data and NHS England data, build a system that could predict were you to be hospitalized, what is the risk of you actually needing ICU admission, and even predicting the number of days you would need ventilator support. Ultimately also leading up to the discussion, would we need to choose you or someone else if we would have a shortage of ventilators? A really fundamental question, I think, and especially in these times. But I think the major challenge really has been doctors knew very little about this. We've been producing, like even in the traditional way, we've produced very poorly reviewed science. So it's even harder to really do diligent research in checking the robustness. And I think that's the major challenge that we have, checking the robustness of these solutions. We know little of the disease. We were working on predicting the flu season for our hospital and the other Dutch hospitals. We could do that very well, but we had 50 years of influenza peaks to actually do those predictions, and we had time to validate. That was non-existent here. So what I think, in at least we would want to know how much data went into it, what really was kind of the description of the data. Were there minorities in there? Where did the data come from? What was the system like? All those really basic questions, whether this model is actually where it came from, actually translatable to the current setting that you want to use it in. And in that respect, is it safe? So I think that is the major question that I, as an end user, in a way, would want to have answered, at least a safety and reliability question, like accuracy question, but also something that we try to tackle within Healthplus. And I really have to stress try, because we see that regulation is not encompassing enough. We try to retrain the models that we have to local practices. Patients, providers, and protocols are different everywhere. So to really grasp that, we think we learn from the major group everywhere and we bring it back to this locality, basically. And especially that is really challenging. So I see a number of challenges throughout COVID, but also in even the regular, the places where we have more time to really ponder, to really safeguard everything.
Thank you. I hear what you're saying about the reproducibility. Basically, that is a major issue that we also know from AI that was used even without this crisis. Reproducibility of one system in an entirely different situation, that is very important. I would like to go over to Frank, last but not least. Frank, please, could you give your statement?
Yeah, so basically, I think if we use AI systems, any AI systems, explainability of the outcome of those systems is one of the most important things in this kind of situations. We've had experience building social simulation models for the crisis, and they're quite complex systems based on social behavior of people. And we think that actually in this particular situation of the COVID is very relevant, because most of the spread of the virus is through behavior of people. So we actually I saw some questions on the chat already on the track and tracing apps. I think early in March or April, we came with a simulation that said actually the apps have little or no effect at all. which was contradictory to some of the other models. We were as surprised as the other people were. So we didn't pretend that we were the ones that knew the answer. But then we actually were most of the time busy finding out, validating, and trying to explain why we have different results. And we actually can now very well explain why it is, and also the reason why the app will not be very effective. And I think this is a very particular example, but this is crucial if you want models to be taken seriously and act upon it, especially in a broader sense, then you should be able to explain it to everyone involved. So this is, I think, one of the things where it's very pertinent.
Thank you very much. I see already in the chat a number of questions about the Corona app, because what you are talking about, Frank, you were socially simulating, if I may call it that way, the effects of the Corona app already, I think, in March with this simulation-based system, and you came to these conclusions that you just mentioned. Do you now that the Corona app, it has been launched, I think this weekend, were you able to have another look at it, or could you tell us a bit more about what you expect from your simulations of the effects of that app?
So my prediction is that, like in all other countries, in the Netherlands, the effect will be zero. It's very simple. So the last news I saw, I think it was yesterday or the day before, 2-point-something million people downloaded the app, which then sounds a lot. But mind you, that's not even 20% of the people. Then not all of those people will actually use the app. So our simulations, and they're not different from other models in that respect a lot, is you need at least 60 to 80% of the people using it correctly and the app functioning always robustly and effectively in order to get any result. Then the second thing, which is very interesting, and no one actually talks about that, suppose you get 60 to 80% of the people using the app and it all functions perfectly. Then the consequence of that will be that like more than 10% of the population will be in self-isolation within a week. And that will continue quite quickly. So within 2 weeks, you will have almost half the country being at home. So what is the effect? And not all of those people are positive, but they might be, because they have been in contact with someone that has been in contact with someone that has been tested positive. So the negative consequence of perfect use of the app is also very large, and no one actually has been discussing that part of the problem. So I think that's the kind of things you can get out of a simulation, and that should be taken seriously. And I find that there is very little discussion because everyone focuses on the epidemiological aspects, the sickness, the illness, people going to hospital. And there are these other consequences which are as important, especially if you see that using the app, especially in the number of people that get hospitalized, hardly changes. And I mean, that's less than 1% less.
This is very interesting because I think it was yesterday that, or maybe even today, that I saw that also the employers and employees organizations, trade unions, now warn for the use of the app because, for example, in the Netherlands, we don't have appropriate testing capabilities to test everybody that gets a signal from the app that they might have been in contact. So people have to isolate while they might not be sick even. And what are we going to do about that? Is your employer accepting that? Well, we wrote a letter in March with some 60 plus experts warning for this situation. I would hate to say we told them so, but basically we did. I would like to go, thank you, Frank. I would like to go to some questions in the panel. I saw some questions about the app that I think Frank already has has answered. But there was another.
If I might add one little thing
Yeah.
on the questions about app, it's actually a very good example of an app that at the end, after all the hiccups that it has had, we can see that it has been developed responsibly, but still it doesn't really necessarily provide the effect that we want. So it's not just about developing it responsibly, but we also need to ensure the effectiveness and the impact that it can have. So it's a very good example of, it's not just about responsible design of the app, it's also about taking into account the impact of that responsible design and of that app in society.
Yes, absolutely. Very, very good point. I have here a question from Koen Smeets, who says, thank you for the fascinating panel. Do you think that the ethics of AI is a more general question? Ethics of AI should also be included in the economics curricula, considering the power of economists in our society? Who would like to give a shot at anything? Yeah, maybe Virginia.
I think yes, we should include ethics and ethics in all curricula, not only on economists. What we also need to realize is that knowing about ethics doesn't mean that people are acting ethically. And it requires much more than just teaching ethics in order to really create an ethical profession or society. So we really need to work on both sides and on the personal, individual responsibility of each one of us in our professions, in our backgrounds, in our social contexts, to take the ethical, responsible way to the behavior.
Yes, absolutely. Thank you. I have a legal question that I might want to ask to Nathalie, because you're from Belgium, so you have an outside of the Netherlands look at this maybe. The question is from Mirella Visser. I observe that some governments want to rush through legislations to, for instance, introduce a corona app, the corona law here in the Netherlands, without allowing sufficient scrutiny and involvement from parliaments. Do you see this too, for example, in Belgium? And how should we address this?
Yeah, that was a bit of fear in the beginning. And there I have to say, for one of the first times, it was really civil society organizations, academia, the public as a whole who kind of protested against that. So when the idea first came of this Corona app, I know that you guys had your letter in the Netherlands. We had a similar letter, open letter, with 100 academics in Belgium that I co-authored. And it had an effect in the sense that it really forced politicians and the government to first have a public debate about, should we have such an app? If so, what should be the safeguards? And that slowed down the process of having an app immediately, but it also ensured that we thought carefully about the implications. And I really wish that we could have a similar public debate with the introduction of many other technologies as well, because people from different disciplines were, at least in Belgium, invited to participate in that debate. There was a kind of a rush to legislation first. There was a royal decree that was adopted in order to rush it through, but that didn't work because people didn't just accept that. So then more and more guarantees came on the table. And at the end of the day, I think the effectiveness remains an open question of the app. And there I also always think about Catelijne's question 0. Should we even use AI in the first place for this? Or, you know, with any technology, we need to ask that question. But from a sense of legal safeguards, for this is actually an example where it's not done that badly, at least in Belgium.
Okay, that is good to hear. We have a couple of minutes left. This is an important question from Janine Kuch. How can it be ensured that the high-level guidelines are also accessible and practical for in the hands of data scientists and machine learning engineers that work on the technical solutions? I can answer that. That is actually exactly what we are doing at ALLAI. We want to translate all these high-level guidelines into practical ways of implementing those. We have programs for that, also together with Virginia and Umeå University, and a new company that Virginia just incorporated into VERI, where we will really try to help organizations, but also the people that really need the help, the data scientists, to implement responsible AI into practice. This went really fast. We're almost at the end of this panel. First of all, I would like to thank you all for joining. And I promised Virginia, I have a number of elements that we can take up into our project, but I want to ask Virginia if she, as the scientific lead of this project, could give her closing remarks. And thank you all very much for joining and for watching. Just one more thing, the website is allai.nl/corona if you're interested. It's in English and in Dutch. Virginia, please, your closing remarks.
Thank you very much. It was indeed very short, and I think we would have a lot more to say. I think what the main message from today and what we should take into the project is this idea that we don't need to wait for regulation. Regulation is here already. There is a lot that we can do already to ensure that our systems, our approaches, our solutions are aligned with privacy, with human rights, with all types of guidelines and principles. It is there already. So it is not something which is going in any way to limit the type of solutions that we can build, but it's a stepping stone for a more innovative concepts, more innovative solutions. Because if we have to take a solution which takes into account all these issues and really be built from the beginning, taking into account fundamental rights and ethical principles and guidelines, then we necessarily are going to get to a more innovative solution if we're done what we would have if we wouldn't take those things into account. So I think that that's a very important issue to take into our project, together with the idea that it's about not only the responsible design of the systems, but also develop systems that really mean something, are beneficial in some way, and really have some effect. Thank you all.
Well, fantastic. And again, thank you so much. And I'm such a fan of all of your work. I know all of us were here with bated breath. I can see almost 40 colleagues who were chiming in. Thank you for the questions that they were giving and for answering all those. And these discussions will continue. Of course, feel free for those online to be tweeting out, of course, to have a look. I was just looking at the website for ALLAI or ALLAI, and there's so many thought leaders there. We want to get more thought leaders, especially from the legal side, from the .com side. Thank you all for joining. And please, if you want to segue to the networking portion of the tab, look to your left, take a look at the cyberspace portion. So again, on behalf of the Inspired Minds team, thank you so much. And we're going to take a few-minute break. And what's exciting is coming up next, we're going to have Monsieur Guillaume Hervé, CEO and co-founder of Zetan Systems. And he's going to be talking a little bit about AI for enterprise and how that requires unique tools to meet the needs of teams and businesses. And so with that in mind, we'll see you all in a few minutes. Thank you all. Merci beaucoup.
Thank you, Joe.
Thank you all.
Thanks.
Bye.
Bye.
Bye. Thank you.
Au revoir.
Bye.
Ciao, ciao. Take care.
Bye.